Welcome to The Explainer. So, if you're a cat parent, there is literally one universally scary scenario that we all absolutely dread, right? You look down at a full bowl, and your normally ravenous feline is just completely refusing to eat. It's incredibly stressful. I mean, cats are already kind of dramatic, we know that. But today we're unpacking the source material to help you figure out exactly what might be going on, and more importantly, what you can actually do about it.
To kick things off, we really need to anchor everything on one absolutely crucial metric, and that number is 24. Look, if your cat skips a single meal here or there, it happens. But if they haven't eaten for over 24 hours, that is a massive red flag. This isn't one of those let's wait and see situations. It's a critical point where you need to get them checked by a vet right away.
Okay, let's dive into this. We're going to logically break down the main causes of appetite loss, starting from simple behavioral quirks all the way up to severe emergencies. We'll cover the 24-hour red flag, pickiness and environmental stress, pain and physical obstacles, serious underlying medical conditions, and finally, your feline action plan.
Section 1. The 24-hour red flag, why waiting is dangerous. We really need to hammer this home because it's a critical takeaway. Waiting past that 24-hour mark is incredibly risky. It turns out cats simply cannot wait it out the way that dogs or, humans can. Because of their unique biology, fasting for just a couple of days can actually cause them to develop seriously dangerous health issues. This biological quirk is really the foundational medical urgency for everything else we're going to discuss today.
And this brilliantly illustrates the core puzzle we have to solve. When a cat stops eating, we have to figure out, is this just a harmless behavioral quirk, like maybe they're just stressed out by your new living room furniture, or are we dealing with a genuine medical emergency, like an internal blockage? Understanding this divide is exactly how we start to piece the whole thing together.
Section 2. Pickiness and environmental stress, the behavioral factors.
Sometimes the answer is surprisingly simple. Cats are notoriously picky. I mean, you could buy the absolute most expensive food on the market, and they'll turn their little noses up if the texture or the temperature is even slightly off. If you've got a picky eater, the source material offers some pretty great tips. Try mixing a little bit of their old food in with the new stuff. If they seem bored, maybe switch flavors, but stay within the exact same brand. Or, actually, if they strictly eat dry kibble, adding just a tiny spoonful of wet food might be exactly the bribe you need to entice them back to the bowl.
But what if the food itself isn't the problem? Well, cats absolutely thrive on routine. Any disruption at all, moving to a new house, getting a new pet, bringing in new furniture, or honestly, even just a shift in your own work schedule, can trigger environmental stress that totally kills their appetite. To combat this, try to make their environment as stable as possible. Give them familiar items, like a favorite bed, and keep those feeding times strictly consistent. And for cats suffering from ongoing anxiety, experts highly recommend talking to your vet about solutions, which can range from calming pheromone diffusers all the way to prescribed medication.
Section 3. Pain and physical obstacles, when discomfort stops the eating.
Now, what's really interesting about this slide is how secondary symptoms become our absolute best clues for finding the root cause. For example, if the appetite loss is paired with vomiting, drooling, or diarrhea, you're likely looking at a digestive issue. So anything from a minor upset stomach to something more serious like inflammatory bowel disease. If they're sneezing, coughing, or have eye discharge, well, that points squarely to a respiratory illness. And if they show obvious signs of pain while trying to chew their food, that's a huge indicator of dental problems, like broken teeth or painful gums, which almost always require professional help.
Let's look a bit closer at those respiratory issues, because there's a really fascinating biological quirk at play here. Cats rely heavily on their sense of smell to actually enjoy their food. So if they're all congested from an upper respiratory infection and literally cannot smell what's in their bowl, the food is just going to seem completely unappetizing to them. It's a direct cause and effect. You'll often need a vet check and some medication to clear up that congestion before they'll be willing to eat again.
Also, just as a quick side note here, if you just got back from their annual vet checkup, keep in mind that post-vaccination reactions can totally happen. Some cats might just feel a little under the weather and eat less after getting their shots. It's usually a temporary, super mild behavioral change and it passes very quickly. But it's definitely an important factor to keep in mind so you don't panic.
Section 4. Serious underlying medical conditions, emergencies, and chronic illness. First up in this severe category, internal blockages. As you know, cats are naturally curious little hunters, and sometimes that instinct means they swallow things they absolutely shouldn't.
Everyday household items like string, ribbons, or rubber bands are huge hazards. If an object gets stuck inside their digestive tract, it causes vomiting, extreme lethargy, and a complete loss of appetite. In these critical cases, emergency surgery might even be required to save them.
Beyond physical blockages, a prolonged loss of appetite can also be linked to some very serious chronic conditions. We're talking about things like kidney or liver disease, pancreatitis, diabetes, chronic pain, or even cancer. I know, it's a really sobering list to hear. But the crucial takeaway here is that catching these behavioral changes early and ruling out these major health concerns at the vet can truly make all the difference for their treatment and prognosis.
Let's just take a deep breath here. As the source material reassures us, many cases are temporary or manageable once you know the cause. It can be totally terrifying when your cat stops eating, but you don't need to panic. The vast majority of these issues, whether they're behavioral or medical, have clear management paths once a professional helps you identify that root cause.
Section 5. Your Feline Action Plan. What to do next. Let's move to our action plan and see how this all builds together into concrete next steps. Step 1. Even if you free feed your cat, actively monitor their daily food intake so you roughly know what's normal for them. Step 2. Note any secondary changes, like dips in energy, sudden weight changes, or different litter box habits. And Step 3. If 24 hours pass without them eating, go to the vet. Seriously, do not wait. Oh, and remember, if you ever travel for work or vacation, make sure you share these exact routines with your pet sitter, too.
We'll leave you with this final provocative thought. Are you paying close enough attention to your cat's routine? Cats are incredibly subtle creatures, and they hide their discomfort exceptionally well. Catching a drop in appetite early relies entirely on you knowing what normal looks like. So take a moment to reflect on your daily pet care habits, establish that consistent routine, and always trust your gut if something feels off. Thank you for joining me for this explainer, and keep a close eye on those food balls.